to the master sabi people them, Dr. Mafudia Suaray and Nurse Inez Kaye. Now this program, well, body na gently.
Hey, now welcome to the program again, well, body na gently. Today, now World Sickle Cell Awareness Day. We get a very special program for una all. Today, me, Inez Kaye, and with Dr. Mafudia Suaray, we get a very great panel. I don't know how to call them master sabi people them, pan sickle cell business. Now then they are so today. Let argue na to Dr. Mafudia Suaray, we go able for introduce the master sabi people there.
Yes, Miss Inez. Thank you so much to we viewer and we listener. Welcome una again to another program of Well Body Na Gently. This is a special program on sickle cell awareness. So now we could host this very special program and we'll get some people and with we for can help you for talk and understand body sick here. So how we dey in a salon. So I'll go introduce them. We get one more might join we later on. I'll go introduce them when it join we. But you know, in alphabetical order, I get Dr. Abubakarr Bah. Dr. Bah na pediatrician na Oladurin Children's Hospital, where you know it is specialized for take care of pikin them we get sickle cell where in Kana Hospital. So now a big person where it can to for the take care of them pikin also. And then the next person, not join we yet, but they might join we later, and Miss Kadie Deen, where they na the UK, where it gets a foundation where they call Sickle Smart Foundation, where they do education and free screening for people learn for know whether or not they get sickle cell. Instead na person we get sickle cell, we they call them people and they sickle cell warrior then, because this sick so na like war and then na survivor then. So they call them sickle cell warrior then. The next person we will get na Mrs. Sia Evelyn Nyandemo. Where in base na kono, formerly be then at the UK, but he don't go back home and base na kono. Mrs. Nyandemo na it gets an organization where they call Sickle Cell Carers Awareness Network. Na non-profits where they na kono where they support speaking the way get sickle cell, that they support them their medical care, that they support even their social needs them. And also that they support the one the way they take care of picking the way get sickle cell, the parents and the guardian them for help them understand what this sick and know how to take care of them picking. So instead na person where he don't born picking the way get sickle cell, and it gets a very powerful story. He lost two picking them to sickle cell. He get one way na sickle cell warrior. In your story, so it's so powerful. We know how for quiz inside this program. We record and separate. So you go there separate now with YouTube and separate now with Facebook page where I can listen to a whole story. May you get a good understanding what it sound like for get picking with sickle cell and for deal with that sick day. So welcome, Ms. Nyandemo. And then last but by no means the least, now somebody way very special to me. I don't know him for a long time. We don't go through, but putting them together. Now my friend, Dr. Sia Kpakiwa. Dr. Sia Kpakiwa, na doctor, na consultant, kidney specialist in Germany. And what to make her especially special, now inside na sickle cell warrior. So inside the now I go go talk to you about how it's how like forget sickle cell then in a doctor. So we go learn, about Dande. So welcome to all we panelists there. If I can just say a quick hello to we viewer there, and then we can get started. Dr. Bah, you can unmute yourself and just say a quick hello.
Hello, family.
Welcome, Dr. Bah. Mrs. Nyandemo.
Good evening, family.
And Dr. Kpakiwa.
Hello,
Okay. And now I just want to do just a little brief sharing of some information on sickle cell before we begin ask the panelists and question them. What's really not this sick here, so we will talk about. So I want to show this this picture here, so for many people then see. When I can see my screen. So sickle cell na sick than the way that they born picking them with her. And waiting they body sick so na sick way then color inherited. So it means that they born you with, and this sick waiting special but and a sick way they affect your blood. So you see by the screen, I show, on this one side, waiting the normal blood cell, then cell and I think they inside your blood, when then they make you blood able for carry that oxygen, the one where would they breathe, there would they breathe, for carry and go all over your body so that your body go able for function fine. So now so they're supposed to look like, if your blood normal, it's supposed to look like then inner tire then, we'll small look in the play with the inner tire then, now then what's aside then. But when person gets sickle cell, instead of the blood cell, they look like inner tire, they look like this now, like half moon, or like, to me, I can say like then cutlass, then curve cutlass there. Now so it look like. The problem where then cell here, so they change, they get then shape here, so they're not that strong, they broke quick, then sticky, that they fashion, they can cause blockage there. They're not able to carry oxygen, the way they normally for carry oxygen. And because of that, they cause beaucoup symptoms and beaucoup sick the way they can cause now the person body. The one way most people they know, but the most common one, they cause pain. So people want, most people, if you don't hear about sickle cell, something say sickle cell, they cause pain. They cause the body for the pain. But other thing and the way sickle cell, they cause, besides, pain, but pain is a big one than they with this sick so. And the important thing for know this now sick way, also which man that they give you this sick, also anything they give you nothing where you they born with, which means you mama and you papa the all two for don't get small pan this one for me you able born picking where get this sick so. Because each person we they give to you picking what you call two gene then we go determine whether you get sick this particular sick or not. So if somebody gets it in a career, in an AS, then he married somebody where instead of in an AS, instead of in a career, they go likely born, at least one or so picking them, where go get this sick so. But if you're not just career, you might not get them symptoms the way they talk about. But the problem is, you might born, if you married somebody back when a career, you might born picking where go get sickle cell. So I just little brief no more for sickles people then understanding. But as we talk about the sick, more which we guess there, I think we'll go understand a little bit more about the practical parts of the sick. So what it really mean to the person we get the sick and to the people there around there. So and I just a small day about one for sure. And then I want for me we can talk to we experts there. So the first one I want more talk to Dr. Bah. If you can unmute yourself, I'll get the first question then for you. Because one of the things that we all know about this sick so we not say na see where you can pass to people then, but but people they don't know for say they get they get this sick so. Because until you begin get symptoms, 9 people they can know. So inside Boku country then at the world, they get what they call universal screening, where we say any picky way them born are that they test them for see if you get sickle cell or you get the trait on so all but what are sick then they. Now Salone will not get down there yet. Will not they test every single picking where them born. So Boku pick but it's the way that they know for say they get this sick so now where them begin get some then symptom there. So how we go know waiting are then symptom so of this sick so, Dr. Bah, waiting are then symptom then where picking then they get where the mama and then daddy or the one that way they take care of them for say, maybe this na sickle cell we need for care and go now hospital we need for care and go now clinic, make them go test them where we know waiting they go on with this speaking. You can help me with that, sir.
Yes, thank you very much, Dr. Suaray, for this wonderful program. If I can answer your question here. Now, as you say, Sierra Leone now gets the opportunity to begin screen picking. In fact, sometimes in the way they can begin screen the mama, where again they can begin screen and they take pattern and blood. The way they begin born. When they became born, don't they can screen and born. We not get that facility now. So how would they know say this picking against sickle cell? Now, most times when picking can born, they show then sign in it, but at the age of 6 months, and it can begin to show signs. One of the commonest signs that we can show, the hand and the foot, it is swell. One of these important dactylitis, the medical term down there. And that one can make now, the pikin, he feel serious pain. He not able to sleep. In fact, day before yesterday, I just get a call from one of a colleague when I lost. Where he tell me saying, begin 2 days in the sleep, he puts the sweat. That's a brain cancer. I get for Sia, my sister, you get dactylitis. I just send basic screening, you get the sickle cell. Way for making the mommy accept and it's difficult because inside not being getting knowledge because you say you don't do you never do tests, no one gets sickle cell in the family. Right? That in one. Don't two. As then they reach 1 year, because of putting the blood cells are very normal, like how you see just now, the normal cell italic in a tar, don't the one we get sickle cell italic will last for like banana. Then it went quick. Normally, the normal blood cell will take like 10 months, but this one at 10 to 20 days, it don't well. So they wait when they make not in the white, don't they the yellow. Another one, every time in the yellow, don't two, they can get infection fast. Because you could say the other two we can get problem with the spleen. The spleen not normal. The spleen and belly, it help for first infection. When you get sickle cell, you get problem. So that's your money when the body develop the spleen will pull out. So then they get infection fast. So then they got fever. Then how then you go over and associate symptoms so they can get manifestation. Something got bone pain now. When the commonest sign there or symptom the way picking can come with, you get bone pain there. Every 2-3 months, you get bone pain, then they will sleep. Then if the thing of you know able to treat and fine, they can go and forget what a contribution and they can get some food cell in the body or the chest. You get issue with the chest, where then cell and they will normal. No block them blood vessels the inside in chest. So you get serious pain what we call acute chest syndrome. Where now like a complication where if you not treat and I can make plenty of them can die. You get other symptoms and based on how you do it, in a big begin you get something what they call priapism, where now other complication where they happen with them. Then everything I can swell, it is for serious pain. When a small picking, when our medical emergency, when they can operation say for pull all the blood, when they block the blood vessel. So I can just hang and so far make at least I give you other parents and then other question. Then I will add more to that one. But the commonest as I say, based on the age, the hand puts the swell in the shine, then they will sleep, and they get one body. Then blood, the dawn, they wait for the blood fast, and then I can yell because the blood way went fast. You go put the eye, so you get jaundice.
Yeah.
Okay, Dr. Suaray.
Thank you. That's a very clear explanation of the symptom then the way them picking them can get. And it bring important point to talk about, the nursery picking getting symptom then it bring and can to you, then you get for send out for medicine test. So Mrs. Nyandemo, I know say with your organization, one of the things that way you passionate about now for they do then testing there. For try for get testing and for medicine picking their so medicine care then go to medical people then early so that they will begin get treatment and proper treatment then early. And you don't work, you they focus na kono. And I know say when you begin your work, you not be even get the blood test them for do. I remember you be telling me so now they check symptom there. So tell me about how na be they screen them people that wanna, them picking them the other people that will be the cancer now. How na be they screen the one that they say this person it sound like saying na sickle cell because you also medical person. So now I make a really like waiting you they talk because I think say it very practical for me. Then when they decide then before they go to doctor, when they don't get doctor, they learn something from waiting you be they do. How na be they what symptom they waiting na be they look on and they say this person here, so maybe you get sickle cell.
Thank you very much, doctor. First of all, sickle cell, I be don't learn a lot now by reading. So when I don't read and I don't know the symptoms, with me picking them, the signs and symptoms the way that they show. Now maybe they go and look for. When they say picking, they bring and can say, hey, this picking is sick, he gets sickle cell. And they ask her why you feel say get sickle cell. Then it go tell me say either in hand and the swell, in the cry pain. Then I go look the picking and I go look in eye. And they look for in belly. And they ask in mama questions them. And the questions are whether they answer, they tick them. Like where it tell me say the pikin, it cry say in bone, they can get swelling at the joints them. I look the eye, I look the belly. By that, I they know say this pikin, it gets something for do with sickle cell. And then they will not be even get the screening state. Once we don't know that one day, before we be even send them to hospital, we start for put them on penicillin, say penicillin, folic acid, and vitamin C. Now so we be the screen there, we be the identify them. Then 10 reach now the hospital brief for make them the test them. When they look for that one mutant trainer S. Once they say now the pikin get S, with the symptoms there, with the register and I will book as sickle cell patient. Now so we they do that.
Listen to this program. Listen to this program.